I'm Dr. Owusu-Akyaw, sports medicine specialist at the Schrader Road office in OrthoVirginia. I also go to our Prince George office a couple times a month as well. I specialize in arthroscopic surgery of the hip, knee, and the shoulder, and in sports medicine. I take care of a lot of high-level athletes, be it dance, football, basketball, all kinds of things. So with injuries to any of these, people who can't get back to sport oftentimes have a lot of mental health stressors. So I want to talk about mental health and how it relates to sports and getting back to sport. I tell all of my patients it's a process. Surgery is just the beginning of the road. After surgery, there are milestones that we look to hit. And I tell everybody, try to encourage yourselves to think about the milestones as you hit them one by one. And before you know it, you're back where you want to be. The role of mental health in sports medicine is very important. We know that scientifically it affects return to sport, ability to play again, and if you can play again, and when you can play again. So I encourage everyone who sees me to take care of yourself holistically. That includes mental health, nutrition, getting rest, and then of course, I'll take care of the surgical part. I want to talk to y'all about one of the fastest growing aspects of sports medicine, and that's hip arthroscopy. That's minimally invasive surgery of the hip, and we can use that to treat a lot of ailments. That includes cartilage injuries, injuries to the labrum, which is like the suction cup that holds the ball in the socket. We can help a lot of people that way. Prior to this, we didn't really have the technology to really put a lot of people back to sports, so they would just kind of deal with their pain. But we now have a whole lot of incredible technologies, incredible techniques that allow us to see people get from debilitating hip pain back to the activities that they love. So that's the fastest growing part of sports medicine. And as we continue getting better and better with our techniques, we can help more and more people. So as it pertains to hip arthroscopy, I'm one of the few surgeons in the area who are fellowship trained to perform this technique. Here at OrthoVirginia, we utilize the postless Stryker Guardian table, which allows us to do the surgery with fewer injuries to the patient, faster recovery, and overall just a better experience. We're the first ones in Richmond to be using this bed, and we have seen great outcomes with people getting back to sport and doing the things that they love. I want to talk about anterior cruciate ligament ruptures. That's the ACL. People hear about this injury a lot. It happens a lot to high-level athletes, basketball players, football players, soccer. It's one of the most common injuries to the knee, and it's growing quickly as more and more people do a lot more sports. It can be a devastating injury because it really sets you back from playing what you want to do. For high-level athletes or anybody who really is, interested in really playing at a high level, we oftentimes recommend surgical intervention, and that's a reconstruction or a remaking of the ACL. It can be a long journey back to sport after this. It could take up to a year to get back to fully playing at the level that you want to. We're finding increasingly that it's important that we work on preventing this injury rather than coming on the back end and trying to fix it. Prevention oftentimes means keeping people conditioned, keeping their legs strong enough to protect their ligaments so they don't get injured in the first place. And then even those who do injure themselves, we want to make sure they don't do it again. So prevention is the name of the game when it comes to ACL and keeping people successful in their sports.